Good afternoon and good morning to you if you are on the West Coast. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health in Public Housing. Thank you for attending today's webinar, Vaping, Talk to Youth About the Risks. This webinar is being recorded and this is a live event. So if you have any inconvenience, please disconnect at this time. We are very pleased to have three great panelists for today's webinar. This is a current topic and based on the news that we heard this morning about the transplant of a double lung transplant that a teenager had in Michigan due to issues with vaping. This is a very good time to discuss the risks and best practices to address this public health issue. The learning objectives for this webinar are, first, we are going to discuss the health risks associated with vaping. We are going to enumerate strategies to prevent youth from vaping, and we are going to review South Boston Health Center's anti-vaping initiative. This webinar is possible. We would like to thank HRSA for funding the National Center for Health in Public Housing. So we are able to provide training and technical assistance to health centers in general, and specifically those located in or immediately accessible to public housing. Just some housekeeping issues just before we get started. Everybody at this moment will be muted. If you have any questions, you can, at the end of the webinar, we are going to have a Q&A session. And you can either use the chat box or the raise hand icon, and your line will be unmuted. We are going to have a Q&A session, probably 5 to 10 minutes, for about 5 to 10 minutes. So if you have any questions, please save your question until the end. One last thing, please make sure that you complete the post-webinar survey. Your feedback is very important and it helps us to improve our webinars. This is just a very, very brief introduction about the health centers located close to public housing. We have, in 2017, we had 386 health centers that reported being in or immediately accessible to public housing, and they served around 4.4 million patients. And 100 of these, 107 of these 386 health centers received public housing primary care funding, and in 2017 they served over 800,000 patients. So without further ado, I want to introduce Thomas Carr. Thomas has been the National Director of Policy at the American Lung Association since October 2010. In his role, he directs state and local tobacco control policy efforts for the Lung Association and is the primary author and editor of the Lung Association's annual State of Tobacco Control report. Thomas also oversees the American Lung Association's state legislative actions on tobacco use issues project, an online database website of the state tobacco control laws. Mr. Carr is one of the country's most knowledgeable experts on state tobacco control laws and policies. Thomas has a BA in political science from Gettysburg College. Good afternoon, Thomas.
Hi, and thanks, Dr. Leon. Pleasure to be speaking with you today. Hold on while I get my presentation up here. Can you see the slides okay?
Yes.
Okay, great, thank you. So as Jose said, I'm Thomas Carr with the American Lung Association. Real pleasure to be here and speaking with you today. I'm going to talk today about the national picture and trends regarding e-cigarettes. Here's a quick agenda for what I'll be covering today. We'll start with some history surrounding e-cigarettes or vaping, talk about the health risks from them, and then how the country is or can address e-cigarettes better or in the future. And in particular, the two significant threats I'll talk about caused by e-cigarettes. So there are two distinct and significant public health crises being caused by e-cigarettes currently. First, we have the youth e-cigarette epidemic, youth e-cigarette use epidemic. The first e-cigarettes came onto the marketplace in 2007, imported from China where they were first created. On September 12, 2018, then FDA Commissioner Scott Gottlieb declared youth e-cigarette use to have reached epidemic proportions. And indeed, the rates continue to go higher, and indeed and unfortunately. The 2019 National Youth Tobacco Survey found that 27.5% of high school youth are using e-cigarettes, up from 20.8% in 2018. So we went from 1 in 5 high school students that used e-cigarettes to more than 1 in 4 kids in just 1 year, which is pretty amazing. And so how in just 11 years did this product go from imported novelty to the most commonly used tobacco product among kids? Then there's also the outbreak of lung injuries that, in addition to the youth e-cigarette epidemic, that we've also been people dying from people picking up serious lung disease and dying from vaping and use of e-cigarettes, which appears to be a significant short-term consequence of vaping. As of November 5th, according to the CDC, the number of deaths stand at 39 deaths in 24 states and the District of Columbia. So before we go into those a little bit more, though, let's first focus on what e-cigarettes are and how they became so widespread. Perhaps the most important thing is that e-cigarettes are tobacco products. First, what are we talking about when we say e-cigarettes? They've evolved over the years, but e-cigarettes are devices that have the shape of a cigarette, cigar, pipe, or pen, and do not contain tobacco, although the nicotine in the products is usually derived from tobacco. They use a battery and contain a solution of nicotine, flavorings, and other chemicals, some of which may be harmful. When electronic cigarettes are used or vaped, the nicotine solution turns into an aerosol that can be inhaled into the lungs. The rechargeable e-cigarettes that look like USB/flash drives are the Juul style of e-cigarettes. The other major type of e-cigarette is the tank model, and you can see it comes in different sizes here. Here's a brief history of e-cigarettes and a brief history of FDA's authority over e-cigarettes, basically. I want to be sure to note the 4-year gap between 2011 and 2015, between the time FDA announced it would begin to regulate e-cigarettes and when it issued its proposal. It took FDA another year after that to finalize its authority in 2016. And in 2017, FDA told e-cigarette manufacturers, that the agency would delay the deadline for submitting their products for FDA review from 2018 to 2022. The American Lung Association and our partners sued FDA for this arbitrary and capricious delay. And then in May 2019, a federal judge sided with us and ruled that FDA is required to have all pre-market applications submitted by May of 2020. So the deadline got moved up basically from what FDA had set it at originally. Then on September 11th, President and First Lady Trump and HHS Secretary Alex Azar announced that in the coming weeks, FDA will clear the market of all non-tobacco flavored e-cigarettes. However, as some people may have seen in the news, the proposal has not yet come out and may be significantly weakened, and I'll talk a little bit more about that later. So during that 40-year delay from 2011 to 2015, during the Obama administration, the e-cigarette industry pulled out every trick in Big Tobacco's playbook to increase the market share of their products, from enlisting celebrity spokespeople to using candy and fruit flavors as well as cartoon images to attract kids. and using paid social media influencers on Instagram and other social media platforms to attract kids as well. And making unproven and dangerous health claims like these. And during that time, again, 2011 to 2015, despite the fact FDA could have cracked down on the products that claimed to help smokers quit, or the Obama administration could have finalized the rules that would allow them to protect kids from these products, they didn't do it. This has really fueled the disinformation campaign around e-cigarettes, and was a contributing factor to some of the dramatic rises in e-cigarette use we've been seeing since. During the delay in oversight, the e-cigarette market was often referred to as the wild, wild west, because literally anything seemed to go. There was no crackdown on those unproven quit smoking claims, and there was nothing to stop e-cigarette manufacturers from coming up with more and more predatory marketing practices aimed at kids. And unfortunately, we've seen the results. We've seen the dramatic increase in e-cigarette use during that 2011 to 2015 timeframe. That was just the beginning, unfortunately, especially among high school students. And this is what this chart is among high school students. And on November 15th, 2018, CDC and FDA released new data that showed a 78% increase this is from 2017 to 2018. The reason, and that's the more recent spike you see on this chart, and predominantly Juul was the reason for this spike, and continues to be the reason. And now in 2019, the number has climbed even higher to 27.5% among high school students. So more than 1 in 4. So just a couple of slides on who uses e-cigarettes. E-cigarettes are the most commonly used tobacco product among youth and have been for a number of years, I believe since 2014. Youth are more likely to use e-cigarettes. Youth are more likely to use e-cigarettes than adults. Over 5 million kids now use them, up several million in just the past few years. And then adult use of e-cigarettes is at 3.8% currently, and that's from the 2017 National Health Interview Survey. The youth use data is from CDC's 2019 National Youth Tobacco Survey. As I mentioned before, the dramatic increase in youth use that we've seen in the past couple of years anyway is all about Juul. Discreet and easy to hide now has over 70% of the e-cigarette market. And unfortunately, juuling has become a verb as well too. So let's talk about some of the known health risks from e-cigarettes, at least as of now. The impact around which the American Lung Association is most concerned for both youth and adults is the impact of inhaling these chemicals and their impact on the lungs particularly. And according to extensive research conducted by the FDA, these health risks to the lungs and to the brain are what resonates most among youth when messaging against the use of e-cigarettes. Note the picture on the slide is an infographic from CDC that is available for general use. So, and it's free as well too. According to the Surgeon General, there is no safe level of adolescent exposure to nicotine. A 2019 study in the Journal of Drug, in addition, a 2019 study in the Journal of Drug and Alcohol Dependence found that non-nicotine e-cigarettes were less than 1% of the e-cigarette market every year from 2013 to 2018, which means that virtually all e-cigarettes contain nicotine, and oftentimes even when their labels claim they don't. You may wonder why e-cigarettes can't be carried in checked luggage on airplanes, and the fire and explosion risk is the reason that you can't. There have been a number, I know I see stories occasionally of fires and explosions caused by e-cigarettes, and this is also a direct result of them not being regulated. There was also a large increase in calls to poison control centers about ingestion of e-cigarette liquid after e-cigarettes have been on the market for a few years and started gaining in popularity. You'll often hear from the e-cigarette industry that two of the most common ingredients in e-cigarettes, propylene glycol and vegetable glycerin, and this is in nicotine e-cigarettes, are on FDA's generally recognized as safe list, but that is only for ingestion. This is really important, not inhalation. A recent study from the University of North Carolina found that even in small doses, inhaling propylene glycol and vegetable glycerin is likely to expose users to a high level of toxins, and that the more ingredients a user is inhaling, the greater the toxicity. Multiple studies have shown that e-cigarettes have become a gateway to smoking, that youth who would otherwise not use any tobacco products are using e-cigarettes and then potentially transitioning over to traditional cigarettes as well too. The 2016 U.S. Surgeon General's report on e-cigarette use among youth contained a number of other important conclusions as well, including that secondhand e-cigarette aerosol is not harmless and contains harmful and potentially harmful characters, and that flavors are one of the main reasons that kids use e-cigarettes. In January of 2018, the National Academies of Science, Engineering, and Medicine also released an analysis of all the major studies on e-cigarettes to date. Their conclusions included that using e-cigarettes cause health risks and also increases the likelihood of kids using and becoming addicted to regular cigarettes. A Pennsylvania teenager who used e-cigarettes for just 3 weeks developed a condition called acute respiratory distress syndrome, or wet lung. And this is different from the lung injuries that we're seeing, or at least some of the lung injuries that we're seeing recently. She was put on a ventilator and fluid had to be drained from her lungs. Experts said her condition was likely caused by the propylene glycol and vegetable glycerin in the e-cigarettes. Other chemicals present that can also cause major damage to the lung. Diacetyl causes irreversible lung damage to the lung, often called popcorn lung, because it was found in microwave popcorn factory workers when it was used as a flavoring. Acrolein is an herbicide used to kill weeds that is also present in many e-cigarettes. It can also cause irreversible lung damage. Aldehydes are among the most toxic constituents of tobacco smoke and cause cardiovascular disease. And they can be present in e-cigarette aerosol as well. Here's the latest CDC/FDA data on the lung injuries from e-cigarettes. It seems that a substantial majority of the lung injuries are among young adult males, and that most but not all the cases involve use of e-cigarettes containing THC, or the active ingredient in marijuana. But this is a new and frightening short-term consequence of e-cigarette use. We get a lot of questions about, the Lung Association gets a lot of questions about whether e-cigarettes can help smokers quit their nicotine addiction entirely or to switch completely. Unfortunately, what is more likely to happen is smokers will use both e-cigarettes and cigarettes, often referred to as dual use. And this does not reduce a smoker's risk from smoking-caused disease at all. E-cigarettes also can also help sustain addiction to nicotine and tobacco. The Annals of Internal Medicine published a study that found smokers who used e-cigarettes to help them quit smoking were less likely to quit completely than those who did not use e-cigarettes. Only 10.1% of the smokers who used e-cigarettes had quit smoking after 6 months, compared to 26.6% of smokers who did not use e-cigarettes. In addition, because of the unknown and highly variable levels of nicotine in e-cigarettes, it is hard to determine the proper dose of nicotine replacement therapy to help an e-cigarette user quit. The American Lung Association has decades of experience in successfully helping smokers quit using proven methods that FDA and the science have found are both safe and effective. And we certainly encourage the use of those FDA-approved safe and effective methods instead of e-cigarettes. So now let's talk a little bit about how a country can address the two significant threats caused by e-cigarettes, and also potentially some of the long-term consequences as well too. In 2017, the Lung Association and our partners released a report exposing how flavors from e-cigarettes and other tobacco products are luring children, called the flavor trap, as you can see on the screen here. Flavors are one of the main reasons kids use e-cigarettes and tobacco products overall as well. And restricting the sale of flavored e-cigarettes is definitely a strategy to address the youth use epidemic that should be considered. In the fall of 2018, FDA launched its public education campaign focused on preventing youth use of e-cigarettes called the Real Cost campaign. And in 2019, FDA expanded the campaign by placing ads on TV as well too. So they've kind of upped the campaign. The Lung Association strongly supports this campaign aimed at preventing youth ages 12 to 17 from starting to use e-cigarettes. Resources are available at therealcost.com that I understand can be used locally as well too. So I mentioned this earlier, but in July 2017, FDA announced a significant delay in pre-market review requirements for e-cigarettes until 2022. Under FDA's 2016 deeming rule, which gave FDA the authority to regulate e-cigarettes, all e-cigarettes not in the market prior to February 15, 2007 were supposed to be subject to review by FDA prior to going on the market. This decision meant that all e-cigarettes, including the ones with flavors that appeal to kids, could remain on the market for 5 more years after 2017. This short-sighted delay has directly contributed to the dramatic 135% rise in high school e-cigarette use seen from 2017 to 2019. In March of 2018, the American Lung Association and our partners filed a lawsuit against the Food and Drug Administration for its unilateral delay in oversight of e-cigarettes and other tobacco products. This resulted in the U.S. District Court judge ruling in the Lung Association and partners' favor and moving the date for pre-market review to May 2020 under court order. As I mentioned earlier as well, on September 11th, the Trump administration proposed removing all flavored e-cigarettes from the market. The proposal has not been released yet, although despite the fact that it said several weeks after, and may contain multiple exemptions once it is released, like a couple that are being considered are shown on this slide. It's important to note that mint and menthol are two of the most popular flavors among kids. With over 57% of kids who use e-cigarettes using mint and menthol e-cigarettes, according to data from CDC's 2019 National Youth Tobacco Survey. In the absence of FDA acting, the American Lung Association is working at the state and local level, urging them to put in place public policies that are proven to reduce tobacco and e-cigarette use, and help smokers get real help to quit. And you can see several of these on this slide. The infographic pictured here is also available amongst our many e-cigarette resources as well too. As one of the strategies noted on the previous slide, the American Lung Association strongly supports including or adding e-cigarettes into smoke-free workplace laws. As of November 1, 15 states in the District of Columbia have added e-cigarettes to their comprehensive laws prohibiting smoking in virtually all public places and workplaces, which means that basically that e-cigarettes are prohibited in the same places that smoking tobacco are already prohibited. The American Lung Association also strongly supports raising the age of sale for tobacco products to 21 years old. As of November 1st, 18 states in the District of Columbia passed tobacco 21 laws, and we really saw an incredible advance forward just in 2019, with 12 states being added to the list just this year. The American Lung Association has decades of experience in successfully helping smokers quit using proven ways that FDA and the science have found are both safe and effective. We have an online program, in-person group support program, and a lung helpline is available to everyone as part of our Freedom from Smoking program, as pictured on this slide. The American Lung Association also created the Vape Talk to help parents learn how to talk with their kids about the dangers of e-cigarette use and vaping. And there's more information about this on this slide, and also it's also amongst our general resources on e-cigarettes, which I'll share a link to in a moment. The Lung Association's in-depth program is designed to be an alternative to harsher punishment. It's designed to be used in schools and as an alternative to harsher punishments, including suspension for students who are not yet ready to quit using e-cigarettes or tobacco products. It's important that schools understand that these kids are heavily addicted in many cases, and that kids need to be treated, not punished. The majority of kids who go through the program increase their interest in quitting as well too. Schools and colleges also have a role to play too. One of the most important things they can do is implement tobacco-free campus policies that include all tobacco products, including e-cigarettes. The fact sheet on this slide is available free on our public website as well too. It's a one-pager designed for what schools should know. So as this slide notes, how can we address the lung injury outbreak from e-cigarettes? CDC in a recent study believes vitamin E acetate, released last week, believes vitamin E acetate found mainly in THC containing products may be playing a role in the lung injuries. They haven't ruled out other chemicals or substances, possibly also contributing to the outbreak though, or ruled out nicotine e-cigarettes potentially playing a role. And also on this slide, the Lung Association recently made a recommendation that no one use e-cigarettes or vape at all. So it took many years before science started understanding the long-term consequences of smoking, and even as recently as the 2014 Surgeon General's report, 50 years after the original Surgeon General's report on smoking in 1964, new diseases were still being conclusively linked to smoking. So unfortunately, it may be a while before we understand if and what the long-term consequences of vaping may be. Certainly some of the short-term consequences are scary though, this lung injury outbreak, and also the dramatic rise in youth e-cigarette use among our kids. So here's a bit more information from the Lung Association on some of our resources where you can find them. We have kind of a one-stop shop for all of our Lung Association resources on e-cigarettes, lung.org/e-cigarettes. You can find, this is where there are numerous documents, including one-pagers for teens, parents, and schools, as I noted earlier. There are also links for other trusted resources on e-cigarettes, including at CDC and FDA. Many of these resources are also available in Spanish as well too. So. Here are a few other important website links that may be of interest to people, or go directly to Lung Association resources that I mentioned earlier, including our in-depth program and the Vape Talk. But I definitely recommend CDC's lung injury update page. This is updated weekly with updated information on the lung injury outbreak, including cases and deaths from lung injuries. And with that, I know we're going to save the Q&A portion of the webinar to the end, but with that, that's everything that I had, but I'm happy to answer any questions at the end.
Thank you, Thomas. Thank you for this great presentation. Peter, can you please make me the presenter again? So I want to thank Thomas for his presentation and the overview and all the information that he provided during his presentation. And now we are going to hear from two great panelists from South Boston Community Health Center. We're going to hear from Linda Doran and from Deanne Winstead regarding the youth program that they have in place. So Linda is a youth program coordinator for the South Boston Community Health Center's Youth Ambassadors Program. Since 2005, the program has helped to partner adults and youth ages 12 to 18 from the neighborhood of South Boston to demonstrate that young people care and can be active members of the community. Linda is a lifelong resident of South Boston, and together with her husband Frank raised a family of 5 children there. She quips that she is helping to raise hundreds of children through the Youth Ambassadors Program because she believes it takes a village. Youth ambassadors of all ages know that at any time, regardless of graduating the program, Linda is there to support and cheer them on in their next endeavors in life. Now we're going to hear also from Deanne Winstead. Deanne started her nursing career in cardiovascular intensive care, working for the Baylor healthcare system in Fort Worth, Texas. Since then, she occupied many positions in various intensive care settings in both Texas and New Mexico. She obtained her master's in nursing leadership and moved to Boston in 2013. Deanne worked as the director of nursing for South Boston Community Health Center from 2014 to 2019 and completed postgraduate work at UMass Boston to become a family nurse practitioner. She occupies a provider position as the director of convenient care and provides after-hours sick and walk-in care for the patients of South Boston Community Health Center. She lives in Dorchester with her husband and 2 mini dachshunds. Without further ado, good afternoon, Linda and Deanne.
Good afternoon, everyone. Good afternoon. So we're here to talk about the Youth Ambassadors Program at the South Boston Community Health Center. The South Boston Community Health Center has been in the community since 1972 with 15,000 patients per year, 60,000 visits. We have 50 PCPs with 25 attending doctors, nurse practitioners, along with 25 residents. We have 3 clinical sites, and as an FQHC, we offer dental, eye, behavioral health, along with other on-site specialists in cardiology, dermatology, pulmonology, podiatry, GI, sports medicine, hepatitis treatment, and office-based opioid treatment. We're part of Boston Health Net. We're Boston Medical Center as our sister, our mothership, I call it. Yeah. And moving forward. So we're here to talk about a Youth Ambassadors Program who have made great inroads in the problem of youth vaping. Our program has been in existence since 2005, and we have had more than 300 kids come through the program. We have empowered the kids through the years to let us know what their concerns were in the community, and we've dealt with everything from teen sexual health, mental health, stigma, opioid and other drug problems in the community, and most recently the youth vaping problem. So Youth Ambassadors Program is a strengths-based program founded by our CEO in 2004, William Halpin, who had the wonderful vision that youth had something to give to the community, and they had a need. Adolescents have a fundamental need to contribute to the community. So we're focused on the youth of South Boston, focused on youth development, health promotion, and leadership building activities in the program. As I said earlier, more than 350 youth have been served by the program. We currently have 26 participants in the current program, most of whom live in the housing developments. We have 3 housing developments in South Boston. Within 3 square miles, there are 3 housing developments, and I would say 95% of our youth live in the housing developments. So weekly meetings and additional peer leader trainings and topics that include the anti-vaping initiative, teen mental health wellness, which is Stop the Stigma, substance abuse prevention, and nonviolent communication, violence prevention. We have our yearly evaluation done by social science research, and some of the highlights have been that 100% of our youth ambassadors report that they felt the program helped enhance their resistance skills. 89% felt that the program enhanced their teamwork and leadership skills. 89% felt their sense of personal power and control over their lives. 100% learned about the consequences of alcohol and other drug use, and 92% felt the program provided them with meaningful opportunities to provide service to others, which we feel is the most important part of the program, that they have a venue to show that they have something to give.
I'm just going to interject here. This is Deanne Limsat, and I just wanted to mention that one of the most sort of impressive things to me when I first came to South Boston Community Health Center was that Linda was very active with taking the kids in the program out even to other states and other cities to help or for them to give back to other communities in service projects. Many of them were related to, tragedies or environmental tragedies that had happened. They were helping with cleanup from hurricanes and that sort of thing. And I really thought that was just such a wonderful example of how the program tries to look beyond, is very focused on the South Boston community, but was also very instrumental in providing assistance to other communities as well.
Thank you, Dan. Mm-hmm. So back in September 2018, during one of our weekly meetings, the subject came up. We were talking to the teens about what is their concern, their most recent concern. And a lot of them began talking about the vaping in the school bathrooms. And I have to be honest, I had heard about vaping. I knew about electronic cigarettes, but I never realized the extent of youth vaping until that minute. And when kids are concerned about their peers and want to do something about it, that's when we help them to gather information and figure out how they're going to go out into the community and connect with their peers about information about the problem. It ended up, once we began doing the research especially about Juul, because that is the focus for teens. They don't say electronic cigarettes, they just say Juul, juuling, and that's it. And I think that's because the tobacco companies have done a very good job of marketing to teens and making it sound like something, that's not going to harm them. It's a Juul. It sounds like a diamond. So we prepared the youth peer-led presentations that were geared towards prevention of vaping, and the kids did some serious research. They practiced amongst our group, and then we went out and we have presented to more than 380 youth in the community. And we make it fun. We've presented to kids as young as 7 years old, all the way up to 22-year-olds that were vaping, and even when the 22-year-olds heard that, yes, there is very high concentration of nicotine in Juul, they were kind of shocked. and it took a little bit of persuasion to get them to understand exactly what they were ingesting. But when it came from their peers, they listened, and that's kind of across the board with any health issue. Peer-to-peer intervention and knowledge and sharing knowledge and counseling each other is been very effective for us. Okay. In March 2019, we were recognized by Fox News and interviewed. The youth ambassadors were interviewed, and it was still kind of a new, there were no red flags really in the media yet. So we got a lot of negative feedback from the news story that ran, and there is a link at the end of this presentation if anybody wants to see it. People were saying, you know, you need to think of something more important to worry about, and, you know, kids should be doing things other than worrying about vaping because vaping's safe, and, you know, so we had to help the kids process that. Even people on the street were approaching our kids and saying, you know, you should worry about the opioids, not about vaping. The kids were like, okay, well, we'll see. And then it kind of just blew up after that. So again, as far as the outreach, we're in the State House in May of 2019, talking with a lot of legislators about Juul and its effects on the kids, and hoping that some laws would be passed. And there were quite a few legislators that were working on the issue, but it really hadn't become publicized yet. June, again, we met with Boston Public Health Commission, parents and educators, the Boston police officials. And then, you know, then it began things really began to happen about all of the lung issues and things that were coming up. And I feel very blessed that in September 2019, our governor, Charles Baker, declared a 4-month ban on all vaping products. That's still in effect right now, I think, until January. However, you know, youth ambassadors report that many of their peers that vaped before the ban continue to do so. We have some really sad stories about kids continuing to vape on school buses, even in classrooms, despite the ban. So that tells me that youth are hopelessly addicted to nicotine, and that's what troubles me the most, that most of them don't even realize how addicted they are. So that's what we're working towards now, is helping kids that vape realize that, you know, there is help, and it's kind of a next step for us. I'm sorry. So go right ahead, Dean.
No, I was going to ask you to tell the story about one of your ambassadors who was staying over at a friend's house and he only stay if he.
Yeah, I have quite a few sad stories, but the one that really sticks in my mind is the teen wanted his friend to sleep over. One of my teens was asked to sleep over a friend's house, and he said, Linda, I don't want to sleep over his house because he vapes. You know, he wants me to come over and play video games. He's going to be vaping the whole time, and I don't want to be around that. And the kid that vaped said, no, I promise I won't vape. And he didn't that night. But my youth ambassador woke up in the middle of the night at 3 a.m., and the 16-year-old boy was out in this backyard vaping. So he wasn't doing it to be cool. He wasn't doing it, you know, to say, look at me. He was doing it because he's so addicted to the nicotine. He had to. He had no choice, and they continue to have to. There's another story of a boy, 17 years old, he's in a vo-tech school, and he was in his automotive class. And he had the big, heavy gloves on, and he had the Juul inside the glove, vaping in class, in an automotive class with all kinds of chemicals. And you know, again, my youth ambassador told me about this story, and it's just so sad. So that's it for all I have to say right now. I'm open to questions. There's so much to say about this subject. I believe that we are just seeing the tip of the iceberg as far as the problem, and hopefully we'll have more and more resources to help our teens deal with this. That's it. Okay, well, thank you very much.
Thank you, Linda, and thank you, Deanne, for sharing the ambassadors program on the youth initiative. I'm sorry, the anti-vaping initiative. I believe that is great information, and it's very glad to hear what the youth can do for their peers. I believe that this is a program that can be adapted, or put in place, and other health centers may be interested in doing the same kind of initiative just to address the issue. So thank you so much for sharing the information and the best practice. We are going to start the Q&A session. If you have any question for either Thomas or Linda or Deanne, that you can do it now. You can either use the chat box and type your question, or if you dial in, you can use the raise hand icon, and your line will be unmuted. And while we wait for some questions, I would like to ask some few questions, and I would like to start with Thomas. Thomas, is very interesting to see the increase in the percentage of those using or vaping from 2017 and 2019, and then the percentage is incredible, from 11.7 to 27.5. And you said that mostly it was due to the use of Juul. Was this because they increased the advertising, or there was what was the or some of the causes of this for this increase?
I mean, I think it's, I mean, certainly, yeah. I think there was they had a large presence on social media, and there were a number of ads that there were a number of ads that they ran that used like attractive teens or young adults, basically. They used a lot of the same tactics as the tobacco industry previously used to make products look basically more socially acceptable. I think the fact that it looks like a flash drive and is very easily concealable, so like teachers couldn't tell if they actually had a flash drive or if they had an e-cigarette. I think was part of the problem as well too, and allowed surreptitious use. They also the aerosol can be difficult to detect as well too. It doesn't create as much of an aerosol apparently. I guess the other thing I'll note too was that they also have basically a new formulation of nicotine called nicotine salts, which apparently makes it easier easier to inhale and easier to absorb nicotine as well too. So I mean, I think there are a variety of reasons, but those are a few. And like I said on one of the slides, I think they have now have 70% of over 70% of the e-cigarette market is basically Juul. So.
All right, thank you, Thomas. That's pretty interesting. The other question that I have, Thomas, is regarding the online resources that you showed. Are those free? So if health center needs additional resources or information about vaping, they can go to the American Lung Association website and download these resources.
Most of them are, yeah, especially the ones that are like the one pagers and that kind of thing as well too. Some of our programs may have a cost to them, but any of the kind of the materials and resources I showed off in the slides are free, so it can be accessed at lung.org/e-cigarettes.
Excellent, thank you, Thomas. Yep. And I'm going to stop for a moment and ask if they would have any questions from the audience.
No, we don't have any questions for now.
Okay, so in the meantime, I would like to ask some questions to Linda, and specifically regarding the at-risk population. You mentioned 3 clinical sites or 3 clinical sites, and the question is regarding the at-risk population. So you mentioned around 380 young people who either are at risk or receive the training. Am I correct in that number?
Oh, we've had over about 380 youth that have come through the program since 2005. So
And
they've been trained in various health-related issues.
okay, and the initiative, your anti-vaping initiative, is this an ongoing initiative? Are they still presenting to other young populations?
Yes, we are. Things have changed a little bit because of the ban, and we had made a number of presentations. Our next step was to go out and talk to the local neighborhood stores to get the jewel signs and things like that out of the store windows at child's eye level. And actually, it's the same marketing strategy that the cigarette companies used 30 years ago. So we were going to, that's our next move but now with the ban, people are feeling very on edge, let's say, because of the ban. They're feeling very, I don't know, they feel they should be able to buy the vaping products with no problem.
And I would say store owners are feeling very defensive.
Yes.
Because of the loss of income.
Yeah, the loss of income for store owners and everything. So we've got that little initiative on hold right now, but our kids are actively involved in talking to groups still about the dangers of vaping, the ingredients, and the promoting resistance skills and things like that.
Thank you, Linda. And this question is for Deanne. Deanne, this is somehow kind of clinical, but is there any effort to identify those who are vaping in the community, and is South Boston offering any strategy or any treatment for those who are trying to stop vaping?
Yes, absolutely. So we, we're a community health center, and we have many initiatives that are usually ongoing simultaneously. But one of the things that has been consistent since I came here is that we always screen our patients for tobacco use. Now, when I first came to the community health center, it wasn't necessarily focused in on vaping, and we didn't necessarily have a means to sort of separate out the screening for tobacco versus screening for e-cigarette use. We now have that, and our EHR supports, a sort of an extended screening. So we're now asking our patients those questions at least once a year. If someone is screening positive, meaning they're using tobacco in any form, including vaping, we have several things that we can do from there. Of course, we offer all of the FDA-approved safe treatment modalities and cessation counseling. But we also have a staff member. Her name is Kathleen Toland, and she has been doing smoking cessation and tobacco cessation in this community for many, many years. And she operates in sort of a peer counseling, peer support role, and operates within the health center. And so we often will also make referrals to her for folks who are looking for tobacco cessation.
Excellent. Thank you. Thank you so much for that information. Fide, any questions on your end?
No, Dr. Leon.
All right. And one last question for Thomas. Thomas, vaping is one of the smoking modalities, I guess, if I can use that word, that was not included in the House rule banning smoking in public housing. Is there any update, or has there been any initiative trying to also ban vaping on public housing premises?
There's no kind of systematic update from HUD might be reconsidering the decision. I know the Lung Association certainly recommends that public housing authorities add it to whatever policy they have in place already, as a result of the HUD, the smoke-free housing rule, and they're certainly allowed to do that and go beyond what HUD did set out.
All right, thank you so much, Thomas. And Linda and Diane also mentioned a video. The video will be sent as one of the resources after this webinar. So if for those interested in look and watching the video, if you have any questions about the South Boston Community Health Center Youth Ambassador Program, so you can either reach out to me or you can reach out to Linda or Deanne, and the resources will be shared with you after this webinar. One more time, I would like to just remind the audience to please visit our website, nchph.org. You are going to find additional resources on vaping and smoking cessation, or any chronic medical conditions affecting public housing residents and your low-income patients in general. Please complete the post-webinar survey one more time. You can also join our mailing list and receive different information about HERS funding opportunities and other resources and services, or information on upcoming webinars. You can also follow us on social media or can contact any of our staff members. It's been a great presentation. I'm very pleased to be part of this, to have been part of this conversation. And thank you one more time to Thomas, Linda, and Deanne for this very, very outstanding presentation. Thank you so much to the audience, and if you have any questions, please contact us at any time. Have a great afternoon.
Thank you.
Thank you.